We've got Dr. Paul Ruggieri. He's a practicing surgeon, author of a book, Confessions of a Surgeon. Welcome, Dr. Paul.
Thank you. It's great to be here, Brian.
Yeah. I understand we had you set up yesterday and you got called into an emergency surgery.
Yeah, I was on call the night before, and there was emergencies that came up the next morning. It's just part of my life.
Yeah, well, I appreciate that. Now, your book is of an interesting subject because you're not only an author, published now, it's on Amazon.com and it's on Barnes & Noble, but you're also practicing active surgeon, and you're talking about things that, you know, in your industry is kind of a place you don't go very often, which is, and I'm going to read one paragraph from your book, and I'll let you respond to the question. A recent study from major Boston teaching program reviewed instances in the operating room causing disability and death in surgical patients, and it revealed that 2/3 of these incidents involve a surgical error during an operation. Of these, 66% involved a technical error, and 33% involved an error in the actual operation. So you're bringing up a subject that's kind of one that most would like to avoid. The question is, why? Why did you decide to write this book and bring the subject up?
I think, Brian, I believe in the truth. I'm very honest with my patients. I tell them up front what could happen. If it happens, I tell them why it happened. I've always tried to live my life that way and my professional life that way. Within the surgical profession, we've known this for years. Surgeons have known that errors occur. I mean, I have made errors in the operating room. They're not intentional errors, but they happen. And we've been reluctant to talk about it for a lot of reasons, for a lot of complex reasons. But I think there's a move for more transparency in medicine today, and you're going to find a lot more people like myself. I wrote about it in my book, but willing to talk about it and write studies about it. It's a fact of life. We're human beings. We don't do every operation perfectly as much as we'd like to.
Now, one of the things in your book you talk about is that burnout is a significant contributor. So, it seems like burnout is a big factor that Americans face in every element of their life. Let me ask you, is the burnout that surgeons face that contribute to some of the errors, is it too much paperwork? Is it the politics of healthcare? Is it the cost cuts that have come because of things like new healthcare legislation? Or is it simply not enough doctors? What would you say is the biggest contributor to doctor burnout in the operating room?
Well, to be honest with you, Brian, I think it's all the above. It really is all the above. I think surgeons particularly are working, patients are more complicated, they're working longer, they're on call more, their fatigue is longer lasting. I was on call a couple of nights ago, I was up most of the night. The next day I was tired. And fatigue can lead to errors if you allow it.
Now, is it because the doctors need to work a certain hours and see a certain number of patients? It's because they're compelled to be there for their patients? Or is it because, is it not possible for doctors just to say, I'm going to check in at this time and check out, and then another doctor is going to come in and take my place? Or is it not that simple?
No, it's not that simple. Most surgeons that I work with are old school. They want to see their patients regardless of what time of day or night. Lately, as hospital systems buy up practices and surgeons, more doctors are signing out at a certain hour. That's becoming more prevalent.
Is that a good thing or a bad thing if the doctor signs out and another one checks in, but there's the same patient seeing both doctors? Does that become a problem?
Well, it may be a good thing for doctors in the sense that it'll lessen fatigue. They'll be more vitalized the next day, but in a bad way, the patient they sign out to, the doc who takes care of that patient may not know that patient that well and respond appropriately. So there's good and bad to that aspect of surgical care, but that's what's going on in hospitals today. There's hospitalist program where hospitalists see patients certain times of the day, and then they sign out to another hospitalist that night. It's a fact of life, partly because of the shortage of doctors, the shortage of surgeons, partly because the patients are more complex, but that's where healthcare is today, unfortunately.
We're talking to Dr. Paul Ruggieri, a practicing surgeon, author of the book Confessions of a Surgeon. Preventable patient harm is the third leading cause of death in the United States, he tells us, and over 400,000 people affected by it each year, likening it to the burnout of doctors today because it sounds like a number of factors, ultimately resulting in a shortage of manpower. Why aren't there more people wanting to be a doctor? Let me ask you this question a little bit differently and allow you to respond to both ways of me asking the question. It appears to me that being a doctor, while a long commitment in education can be very profitable, You can make really good money, have a great life as a result of being a surgeon. You've got to invest a lot of yourself into it. But why aren't more people wanting to be a doctor?
Well, in part because it is such a long haul, especially surgery. You need 4 years of medical school, it's 5 to 7 years of surgical training. It's a long haul to be a surgeon. And at the end of the day, when you come out, with healthcare changing today, the income potential may not be there as it was in the past for a lot of people. I think.
Are you saying? Would it be fair for me to state? Now, I don't want to turn this political, but it's important to ask this question. Are you saying that there is becoming, because of the Affordable Care Act and other legislation that's come out, that it is disincentivizing doctors to become doctors, perhaps, and they go into some other profession because there's no certainty as to how or what they're going to get paid? Are you seeing that in the profession now?
I tend to agree with that. I think because of what's happening on a federal level, hospitals are forced to act, and they're consolidating, and they're buying up practices. And physicians today, specialists today, are becoming employees of big hospital systems.
Is that a bad thing that the small family doctor practice with its more personal service is being bought up by the big regional or national hospital chains? Is there some advantage to the patient there, or is it pretty much a downside? What would you tell the listeners as far as what your thoughts are on that?
Well, I think there's good and bad. Physicians today, particularly primary care, they have a hard time surviving independently. They have to join a bigger system to get support.
Is that because of errors and omissions, or is it more than that?
Well, I think it's partly because the patients are more complicated today. They need more manpower to take care of their patients. Partly because reimbursements have gone down, and primary care particularly need to be part of a system that guarantees them an income. Myself as a specialist, I'm kind of at a crossroads there as well. My group is independent. We've been independent for 30-something years, but because of the politics of what's going on, we may be forced to join a hospital system.
What might be, and again, we're talking to Dr. Paul Ruggieri, practicing surgeon, author of the book Confessions of a Surgeon. You said you've had a private practice 30-something years. I know a prominent doctor, is a family member in Atlanta, said the same thing. He's disgusted by what's going on right now. He's a rheumatologist, one of the best in Atlanta. And he said the same thing to me. I may end up having to sell or roll in or do whatever. What is the straw that broke the camel's back on that if it happens? What's the one thing where you wake up one day and go, okay, I'm going to cave and sell to the big hospital? What will be that item?
Well, I think there's several items, but I think the biggest one, particularly for our group, is because of the politics of where I practice, I rely on referrals from primary care doctors, and in the past it's been based on my quality, my being available. Today it's not based on that. Primary care doctors are aligned with hospital systems, and if you're not part of that hospital system, they may cut off your referrals, and you won't have any business. If they want you to be part of their system, either you join them or you're against them in some communities.
And that's an interesting point, because we've seen that in our own state here in South Carolina, where a couple of, I don't know if you'd call them primary care, but more of a slight emergency care type facilities are being taken out of even the insurance coverage of some of the big groups in our state. We believe that's because hospitals and bigger care providers are pushing that and quietly pushing on that, creating the little guy. He's having a hard time keeping even his patients where they can get insurance coverage if they use him. And this all seems to revolve around the Affordable Care Act. It is an interesting discussion. One final question, because your book centers around, and again, Dr. Paul Ruggieri with us talking about his book, Confessions of a Surgeon. Your book focuses around making mistakes, and you even share mistakes that you've had to deal with. How do you recover if you've made a mistake, you're exhausted, you're running a practice, you're dealing with today's bureaucracy, and you're in surgery, there's burnout, a patient ends up with something, an infection, they come back in, and you're sitting there as a doctor, and they're in bad shape, and you know that you have some responsibility. What do you do?
Well, I talk to them. I admit my responsibility in this, and I tell them this is my plan. I want to fix this. And you tell them compassionately. You talk to them, and usually it works out. I mean, I've been very honest with my patients, and something bad goes wrong. If there's a bad outcome, then I'm happy with it. But at the end of the day, if I correct the problem and they're satisfied with the way I dealt with things, I'm fine. On a personal standpoint, it's hard to admit your mistakes to patients. It's very difficult.
Mm-hmm.
every day, but it's part of what we do, and I think you really have to be honest with patients, and patients, they respect honesty. They really do.
Dr. Paul Ruggieri, great book, Confessions of a Surgeon, on Amazon and Barnes & Noble. We appreciate you joining us this morning.
My pleasure. Thanks for having me, Brian.
Have a great day. Jay Harper has live and local news next.